I am Dr. Murli Mohan, neurosurgeon and head of neurosciences, Sagar Hospitals, Bangalore. I would like to speak about a rare genetic disorder affecting children and young adults, spinal muscular atrophy, a form of motor neuron disease. This disorder is a form of slow death where the kids lose their ability of walking, standing, eating, and even breathing at later stages of life. From this debilitating disorder, a lot of parents in our country suffer. It's estimated that around 3 lakh patients suffer in our country based on the recent statistics. Cure is available in the form of gene therapy, which would cost close to 14 crores, $2 million US. An alternative drug, Spinraza, is available, which would again cost around 5 crore in the first year and 2 crores thereafter every year for life. These medications are beyond the financial reach of any individual in our country. I would like to introduce Dr. Anne Agnes, a pediatric neurologist specializing in neuromuscular disorders and epilepsy, Sagar Hospitals. She, with her struggle and effort over last couple of years with ORDI, the Organization for Rare Diseases in India, have managed to associate with an US-based NGO to make this treatment available for eligible patients in our country for free for life. I would like to thank Anne and her team for this yeoman service. Over to Anne.
Thank you, Dr. Murli, for the kind introduction. Spinal muscular atrophy, as Dr. Murli mentioned, is quite a devastating disease. More so because it is very slow. The type 1s are very tragic, and we don't often get to see those children because they die very early. The type 2 and type 3 affected people and children and the families struggle. As Dr. Murli mentioned, the magnitude of the problem is quite big, especially for a country like ours. We have an estimate, but the estimate is not real because, again, this is from Western data, and we are in many parts of the country a society with a lot of consanguinity, a lot of intermarrying, which makes it more likely that we have more children who are affected by this disease. So, with regards to the facts and figures, there are multiple issues with these children. They have walking difficulties, many of them are in wheelchair, many of them have weakness. If their legs are weak, they are unable to stand. If their trunk body is weak, then there is problems with sitting unsupported, there is problem with breathing. And this doesn't happen suddenly, it's a slowly creeping up thing. So often, in the face of an absence of hope, what is perceived as an absence of hope, multidisciplinary care, common standards of care, which is known in our world as SOC, standards of care, are not often practiced. They are not very expensive, but they are quite labor intensive. They need tertiary and quaternary care centers, and it is difficult in a country as geographically vast as ours for people, especially children and families affected with diseases which affect their mobility to transport. So what is the answer to this? We have premier institutions in the country which does great service, but we need more, and this was an example of a public-private collaboration with a lot of support from parent support groups. ORDI, the Organization for Rare Diseases India, has encouraged us to a large extent. I trained in the UK, and where I trained, this was all there. Everything was in place. It was so seamless for a smaller number of patients, and I dreamt that one day we would have it in India. But then there is a big mismatch of what is possible with cost, even with regards to cost of care. So this is where I thank Sagar Hospitals for the platform that they've provided me, and in allowing me to look beyond the hospital boundaries. They've allowed me to work and collaborate with Baptist Hospital, which is a charitable organization, and between the two of them, we've created a team with, again, support from ORDI, with parents supporting in as well, and volunteers from the team of ORDI, to have a neuromuscular service for children affected with these diseases. So we have been doing this for a couple of years now, and specifically as an entity been functioning for a year, and now this opportunity has turned up where thanks to the US-based NGO Direct Relief, we have been able to give 30 families in the first instance. They've promised 30 families or so, roughly so, this treatment for life as and when they're chosen, depending on their eligibility. Now, for this, understandably desperate families with some hope at last are traveling from long distances, because as a piloting project, the NGO had decided to go with 4 cities. AIMS is covering the northern part of the country. Then we have SDPGI, Lucknow, KEM, Mumbai, and for the southern states, we have been chosen. So we are unlike the others in the sense that we are in the private sector. So we had to make it work. But this is where I feel proud to be part of this, because this is greater than one individual or one doctor. So what has happened here is today, when we conducted the camps, when we are expecting large numbers of patients turning up, one doctor, it is very difficult for them to assess these children. It takes hours and hours to assess them. Multiple doctors across organizational boundaries have volunteered their time, and they have come across. Other than the logistical cost of it, we've tried to keep the cost at a minimum of assessments and have worked between 2 institutions. So we feel proud of the collaboration more than anything else, and being able to show the parent community and the affected community that together we can do something. From a parent's perspective, this is hope. From a clinician's perspective, a clinician who's interested in this condition, I feel more hope rather than just the Spinraza. Yes, as Dr. Murali said, this is a very expensive drug. But for that, we have to be ready. We are an emerging economy, so we need to have ingenious solutions to these problems, which are of great magnitude. At the moment, the whole world is looking at us, and we can show them that we can make different solutions. For this, one of the things is coming together and making research ourselves with collaboration. So hopefully this will happen, and for us, this is an opportunity of health education to engage with the families and also tell them about the standards of care, and even give some hope for those who come. So this is almost like a lottery. If 30, it's a random number, 30. If 30 is chosen and it is divided between 4 centers, there will still be a large number of patients from each center, majority of them, who never get this medicine in the first go, although the company has promised that they would give more. But still, this is a point of health education where we can engage with them and say, even without Spinraza, we can still, while waiting for it, make their life better, which is what is done in Western countries. Children live longer, and SMA kids are amazing kids. They are very intelligent, very talented, and their voices should be heard, and their services they're an asset to the country. Hopefully together we can make a difference. For now, we have opened our doors on this starting yesterday from the 16th, 17th and 18th, but we envisage that this is not going to be sufficient. But we would need to conduct more camps, more such camps, mostly in Sagar and in Baptist as well, wherein we would need help for making it a streamlined process. Otherwise there would be chaos and we wouldn't be able to serve people appropriately. So ORDI helpline will help with this. Thank you.
My name is Shihab. मेरा दूसरा बच्चा का टीका ट्रीटमेंट के लिए इधर आया था. वो कैंप था, SMA पेशेंट है वो मेरे को सागर हॉस्पिटल है ना, उसका एक ऑफिसर को नंबर मिल गया मेरे को, पवित्रा नाम का, इसलिए मैं इधर आया था. कैंप पे पूरा मेरे को अच्छा लग रहा है. पूरा मेजरमेंट तो ज़्यादा रहते हैं और मेरा बच्चे को 1 साल से ये स्टार्ट हो गया था. SMA का था, वो चल नहीं पाता था और वॉक स्टैंड भी नहीं था. वो सब मेरे केरला का हॉस्पिटल से कंफर्म कर दिया था, अमृता हॉस्पिटल से. और अभी बेंगलुरु पे एक कैंप तो मेरे को अच्छा लगा है.
मैं राजीव कुदिशिया, मध्य प्रदेश, भोपाल के पास विदिशा शहर का रहने वाला हूँ. मेरे को व्हाट्सएप के थ्रू ये जानकारी मिली कि पूरे हिंदुस्तान में SMA पेशेंट्स के लिए ऑर्गेनाइजेशन ऑफ रेयर डिसीज़ ने 4 सेंटर जो है फिक्स करे हैं, जहाँ के बच्चों का फ्री SMA टेस्ट होना है. जब हमने पहले मुंबई हॉस्पिटल में अपॉइंटमेंट लिया, वहाँ जाके ये मालूम पड़ा कि नहीं, आपके बच्चे का यहाँ पर ये टेस्ट नहीं होगा. 12 साल के बच्चे तक का बच्चे होगा, 12 साल के बच्चे के आगे को हम यहाँ ट्रीट नहीं करेंगे. तो उसके बाद दूसरा व्हाट्सएप हमारे पास ये आया कि एक बेंगलोर में भी 2 सेंटर रहेंगे, उनमें से एक सागर हॉस्पिटल है, वहाँ आपका जो है बच्चे का टेस्ट आपका यहाँ हो सकता है. तब हमने सागर हॉस्पिटल पे हेल्पलाइन के थ्रू फ़ोन पे कांटेक्ट करा. उन्होंने हमारा रजिस्ट्रेशन करा. रजिस्ट्रेशन करने के बाद हमने उनको ये बताया कि हम जैसे मेरा बच्चा 17 साल का है, कोई उसको दिक्कत तो नहीं, यहाँ पर लाने के बाद ऐसा तो नहीं मना कर देंगे. तो उन्होंने बोला नहीं, आप लेके आइए, हम उसका टेस्ट करेंगे. हम यहाँ पर 17 तारीख को सुबह 8:30 बजे आए. हमारा रजिस्ट्रेशन हुआ. रजिस्ट्रेशन होने के बाद जो है पूरे टेस्ट वगैरह जो है वो सिस्टमेटिक यहाँ पर हो रहे हैं मेरे। मैं इससे खुश हूँ, ये अच्छा काम किया जा रहा है और आगे ट्रीटमेंट मिले। हम ये उम्मीद कर रहे हैं कि जल्दी से जल्दी बच्चे को हमारे को ट्रीटमेंट मिले और वो हेल्दी होकर वॉक कर सकें।